Let me bring in two of my guests now. Javier Becerra is a Democrat who was heavily involved in this process. In fact, if you stayed up late with Wolf and John King and these fellows the other day and followed this, he was one of the lawmakers who was introduced afterward, who gave a speech standing alongside Nancy Pelosi and the rest from the House. Also joining us is Republican Darrell Issa. There I go again. You know, I'm sorry, Congressman. It's the Hispanic in me. I see ISSA, and I want to turn it into... I bet you I'm not the only one who does that.
Well, sadly, my grandfather got us in this trouble because his name was Javier Issa when he came from Lebanon, and he wanted to be anglicized, so he became Issa. So nobody gets it right unless they happen to agree with my grandfather.
It's all those immigrants, Rick.
It's just immigrants. There it is.
You guys, it's funny because I read your name 100 times a day. You're as much in the news as anybody there in Washington. I talk to people about you all the time, and I can't get that Issa out of my head. So I apologize. It's Issa, and I will make sure that throughout this conversation I get it the right way. Let me start with you, Congressman Issa. Former Bush speechwriter David Frum, he's ruffling some Republican feathers. He says that your party would have done better politically and would have served the country better by working on the reform with the Democrats instead of just saying no, 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 and no. Now, this is Frum. He's a Republican. That's why I ask you about this. What do you make of that?
Well, you know, everyone's entitled to an opinion, including former speechwriters. That's why we have Dana Rohrabacher, a speechwriter from the Reagan administration, as a congressman. But the fact is that there are freestanding bills that we offered, that we tried to put in all along the way. I think at the end of the day, it's more of a tragedy for the Democrats that 34 Democrats were not included in the process and they voted no, than it is the question of whether Republicans got in. You'd probably have to get most of those 34 Democrats on board before you begin getting Republicans from an ideological standpoint. But I certainly would love to have done what the president said at our retreat, cut this thing into pieces that all of us could agree on, particularly when it came to pre-existing conditions, portability, some of these important issues that are
I get it.
Either, at least be slightly done.
Let me press you on this just a little bit, though, because I read what you said to the Huffington Post, and according to the Huffington Post, they're quoting you as saying that we don't need to listen to David Frum because he was a part of an administration, the George W. Bush administration, that didn't do very well with domestic economic policy. You stand by that statement?
I do. That when you really look at where President Bush, W. Bush, consumed his political capital domestically, Medicare Part D and No Child Left Behind, he really didn't put any emphasis into dealing with the spiraling up cost of health care. And to a certain extent, we deserve blame, but I think that administration certainly is pretty absent on cost control as a part of their fundamental being domestically. I understand there was a war, we were attacked, there were a lot of reasons, but I think when a speechwriter from that administration says we should have done something, he forgets the man he worked for should have done something on his watch too.
So are you on the record as saying that we shouldn't be listening to anyone who worked in the George W. Bush administration because they are not credible based on their record? Is that what you're saying?
Well, not at all. First of all, I think there are some accountable people, some cabinet officers, and certainly the president and the vice president, that we would continue to very much use as a resource. But I think we also have to be honest. This is an administration that did not watch the pennies, and our deficit rose under their watch, some of which was related to the war, some of which wasn't. They certainly didn't deal with the economic looming disaster. They took credit for the rising home ownership, but not the rising costs that made them unaffordable. So I think, you know, as a Republican, you don't throw them under the bus, but you also don't sugarcoat the fact that they weren't perfect, that there are some things this administration is focusing on that we should be doing everything we can to be involved in a positive way. I just don't think we were given an opportunity to be involved in a positive way.
That's extremely transparent of you to come on this show and say those things. I'm struck by your candor. No, I'm serious. I never expected to hear you say that on national television. Congressman Becerra, let me bring you into this argument because I'm hearing, by the way, now, and let's just move over to health care if we possibly can. I'm hearing an awful lot of Republicans that are saying if there's a way that they can block this or repeal this, they're going to do so. What is your reaction to that?
Snap out of it. The vote took place. The policy is now law. Let's move on together bipartisanly and make it even better. The American public heard all the arguments. They didn't buy the distortion. They didn't buy the death panels. To some degree, I think they bought this government takeover. But as Darrell and I would have to tell you, we have government health care. We get it through the government. And by the way, if anyone visits a doctor today, will it surprise you that that doctor is still there? You still can go to your same doctor. We didn't send the doctor to the gulag. It's time to move on. We need to get this country back on track, put it back to work. We passed this legislation. Now let's make it work well for everyone.
That's just it. And the Republicans' point is, we need to put people back to work before we fix people's health care, and you Democrats aren't being real honest with how much this actually costs. And that's what I'm going to drill down on you when we come back, if you don't mind sticking around past the commercial. Cool with both of you guys?
We're here.
We'll do just that.
Absolutely.
All right, stay right there. More with my two congressmen who were late getting to their seats because, as you could tell, I had to ad-lib to get them there. We had a vote going on, and they needed to vote. It's what they need. Congressman Issa, Congressman Becerra, do you guys know who's #1 on Rick's list today? I want to introduce you to Rosalynn.
Are we together?
No. Listen to this. Do you guys have a monitor in front of you? Can you see her? Can you see?
We don't.
Oh, man. Let me introduce you to Rosalynn Jones. She loves our show, watches it faithfully every day. She's written and said she wants to come on, and there she is. Rosalynn, how old are you?
91.
She's 91 years old. God bless her, huh, guys?
Years young, Rick.
She's wonderful. We're glad you're here. And she and I are going to do a little, don't cry. Be happy. You're all emotional over there. You and I are going to do a little ditty in a little while, okay? A ditty, a dance, like Buzz Aldrin. All right, we'll get to that in just a little bit. I'm glad you could partake in that, gentlemen. Hey, listen, I'm wondering, because, you know, there's sides to this story, and I'll start with you, Congressman Becerra, that sometimes I just think we need to be a little more honest. I'm wondering if, as Democrats, you shouldn't say, yes, this is expensive, it's damn expensive, but we think it's so important that we need to pay up and do this, rather than saying, oh, it's going to pay for itself, et cetera, et cetera. Are you being genuine when you say this thing really will completely pay for itself?
Well, absolutely. And you don't have to take my word for it, Rick. Take the word of the independent, nonpartisan referee that handles all this for Congress and the administration, the Congressional Budget Office. Remember, it was tough because we did have to make sure that it would take care of itself. It's a $94 billion a year expense. That's not cheap. But we come up with savings above and beyond that. Some of it's painful, some of it's just smart. The 60 Minutes reports on waste, fraud, and abuse in Medicare, the Medicare mills, we're going to try to get all that out. We're going to try to make sure that we don't have doctors repeating tests all the time. You don't need 4 x-rays of your teeth. And so getting rid of that excess will save us money. But at the same time,
but how soon? Wait, let me just stop you there. How soon? Is this something?
Some of it.
Go ahead.
Some of it pretty quickly. Some of the reforms can take place pretty quickly. Some of them will take a little longer because remember the exchange where those who don't have insurance start to come in starts to take effect over the next 2 to 3 years. The reforms take place immediately for those who have insurance. The exchange takes a little bit, the architecture takes a little longer to build, but we'll start at that because you need to get there to have that savings go across the system. But remember, it's a $2.5 trillion system.
Hold on. Let me bring in Congressman Issa in this conversation before we get into the detail or the weeds of the numbers, as they say. You know what I would say to you, Congressman Issa, if I was a Democrat and I was arguing this on their behalf, or if they hired me as a consultant? I'd say, yeah, it's expensive, but you know what's going to happen if we don't do this? Do you know that the U.S. economy could even be crippled in the future if we don't do this? Because it's getting more expensive to pay for people's insurance than it is to pay their salaries. I think that would be a more sound argument. I'm surprised that some Democrats don't make that argument.
Rick, I think it's a wonderful argument if it was just in the bill. You know, as you pointed out, this bill spends $1 trillion. Now, whether it's the 500 or so billion you take out of Medicare or the 500 billion you raise in taxes, if you took that $1 trillion, assume you did both of those, and you used it to shore up Social Security or to pay down our deficit at virtually, reducing it by 20% if you did it, that would be one way to use that money. In this case, it's being used for a health care reform system that has many of the things Javier said aren't in the bill. There isn't any real reduction in waste, fraud, and abuse in Medicare. There is no tort reform in this bill. Those are all things that now that the dust is settled, on a bipartisan basis, I hope, we begin working on actually getting rid of this defensive medicine and sometimes simply opportunistic medicine that runs up the cost of health care. We can save billions, but it's not in the bill.
What about that, Congressman Becerra? What about the possibility that some of these ideas that Republicans have brought forward could now somehow be legislated, could be brought into the fold, so to speak? They've been pushing for tort reform all along. Why not put some level of tort reform in?
There is some. So, Darrell, look, next time we'll have to bring the bill and read it page by page.
No, that's okay.
That's not the bill.
That's all right.
The only part I can carry.
What we can do, Rick, is agree that there are reforms in this bill that the referee, not the politician, not this politician, but the referee, CBO has said will save us money. So you're right. What you argue, Rick, is absolutely the truth. We're going to have to spend $94 billion, but we're going to save far more than that. That's why the CBO said after the first 10 years of this bill, we're going to actually reduce the government's deficits by $140 billion. And the next 10 years after that, by over $1 trillion. Why? Because you start to corral the cost of health care. That's what you need to do, because GM can't continue to spend more for health care for its employees than it spends on steel and the cars that they manufacture. You can't
because if not, I get it. They'll go to Canada and start doing stuff there where the people don't have to pay, where they don't have to pay for their health care. Congressman Issa, last question. If you start to see in the next, between now and the midterms, for example, if you start to see that there's parts of this bill that are working, like parents who have 22-year-old son or daughter and they graduated from college and they're not able to get insured, and now they get insured and they're happy with it, would you come out and say, you know what, some parts of this are actually working? Or will you, for political purposes, toe the line and say, no, the Democrats passed it, it must be bad?
Well, I suspect I'll continue to hold up something like this and say this little short bill, 7 pages, could have done all of that. H.R. 3438. It could take care of affordability, universal access. Now, the fact is, these are the good things that are in the bill, extending the age at which parents can support children who otherwise would think they were invincible and not get health insurance. Dealing with the pre-existing conditions, which unfortunately this bill only does for children. It doesn't do it for adults until 2014. Right. But those are things we do agree on. Okay. And I will champion those from before the bill, during the bill, and after the bill. It's really the money and the lack of really reducing overall cost of health care that I'm going to be concerned about in working after the election to make sure that that we work on it so the American people can afford the insurance.
Then we can work together. If that's what Darrell's concerned about, then we can work together.
I love to see it. You know, a Dem and a GOP guy sitting there and they're smiling and nobody's throwing punches. You guys have been great.
We've always gotten along.
I'm kidding.